Okay, we're rolling. Which foods, drugs, supplements, and lifestyle choices affect the health of our thyroid?
Well, everything affects everything when you think about it. And I think that's the big problem in medicine is the fragmentation. What food do I eat for this body part? What drug do I take for this symptom? What diet should I eat for this particular condition? But humans are totally integrated, and what affects one thing affects everything, the whole system. And so the question we need to ask is, what is the right diet? What are the right supplements, if any? And what are the right lifestyle habits that support optimal function of the whole? And then when we're dealing with a disease condition, you may get specific about a particular drug to treat a symptom that has to be treated. For example, if you're a type 1 diabetic, you don't have the option to say, I'm not going to treat it. You need synthetic insulin, okay? So that would be a very targeted thing for a malfunction. But the rest of our time should be spent on what do we do to optimize the whole.
Do you recommend colon cancer screening tests like colonoscopies? What does the science say about the pros and cons of colonoscopies?
Well, there's a difference between using something like colonoscopy for screening versus diagnosis, all right? So if we look at the screening aspect of it, population screening, this idea that when you turn a certain age, you should have a test, this is an entirely different thing. The data for colon cancer screening is that there's not one study that shows that it reduces the risk of dying of colon cancer, population screening. The Canadians took it off the schedule of recommended screenings in 2016. And they did that because there's not one study that shows that it reduces the risk. If you look at the data, 1,250 people have to be screened in order to prevent one death from colon cancer. But in that 1,250 people, you'll have one serious injury or death as a result of the screening itself. So when you save one and kill one, that's a wash, which means no value. So there are better ways to screen if you insist on screening. I'm not for population screening for anything other than cervical cancer. I don't think we have much data showing that this other stuff works. But if you want to do something, the FIT test, which is non-invasive stool test, you can do it at home, is very, very effective, much more than colon cancer screening. There's no risk as you would have with colonoscopy.
How should people think about the FDA, the drug companies, and the medical industry?
The problem with the FDA is that the perception still exists in many people's minds that it's a regulatory agency overseeing the approval of drugs, after-market research, etc. That's not what's happening at all. In 1992, a law was passed that provided for drug companies to pay the FDA to review their products. Now, their jaws drop when I say this. I mean, how can this be? And so they will pay, this is 2020, the drug companies will pay this year $1.1 billion for the review of their products. Now, this won't shock you. The approval rate's 96%. And I want to see the 4% they're turning down. It must be like intravenous arsenic, right? And there probably is a conversation in the hallway. Submit this next year and we'll approve it for you. But we have to look like we're paying attention, right? So we don't have a regulatory body and an industry. We have business partners here, because there's just only so much turning down things or making life difficult for drug companies that you can do when they're essentially funding a great deal of the expense of your agency. That's not the only place where the corruption is significant. The Centers for Disease Control has a foundation. It's funded principally by drug companies, big food, big drug, mostly drug. And many of the committees of the, for example, the vaccination committee for CDC, ACIP it's called, most of those people work for vaccine companies that make vaccines. So it's a conflict of interest you can't ever reconcile. The National Institutes of Health also has a foundation, mainly funded by big food, drug companies, et cetera. And if you have time, I'll tell you a funny story about the NIH. Funny, I don't know, you have to laugh or you'd cry, right? So I think a couple of years ago, the New York Times broke the story that the NIH was collecting tens of millions of dollars from makers of alcohol, in return for which, and there were slide sets obtained that actually showed this was exactly what was being talked about. They were going to do a study showing that daily alcohol consumption was good for you and could actually be like part of the dietary guidelines for Americans or something like this. And so they got caught. They had to give the money back, and they tried to backpedal, saying everybody misunderstood. There was no misunderstanding. The promise was implicit. You give us this money. In addition to that, the National Institutes of Health receives royalties on things like the HPV vaccine. So, and again, you have this business partner relationship. So who is the regulator if the government isn't? Well, nobody's regulating. They're partners. Now, the medical profession, and there are some wonderful doctors out there. I know some of them, and I'm fortunate to know them, because if I needed a doctor, I know somebody to go to trust, right? But as a profession, doctors are complicit with all of this because they take so much money from drug companies and in the form of, not bribes or things that, well, sometimes, yes, they've been caught doing that too, but most of it's entertainment, speaking fees. You know, we're going to do a cruise, a very luxurious cruise, where we're going to educate doctors, and you can be a speaker since you're such a high prescriber. And so we'll pay you $20,000 and the free cruise for you and your family. So there are all kinds of ways that the drug companies funnel money to doctors. And as if that's not enough, one last thing I have to put in there is academic institutions. So if you look at the amount of drug company money that flows to medical centers at universities for research, it's frightening, it's disturbing. And the question I think everybody should be asking is, who's really regulating these people? And the answer is nobody. They do what they want. They're incredibly powerful. They have unlimited funds. I have a friend, by the way, who wrote a book called Deadly Medicines and Organized Crime. And in the beginning of the book, he says, interesting title, provocative. But when you think about it, the mafia, what do? They bribe the government, they steal money, and they kill people. What's going on here? It's not so different, right? And this is a guy who's a top scientist in Denmark. I mean, it's, you know, not some radical person sitting in a closet somewhere. So this is common knowledge, really, but not common enough that all Americans know about it. All Americans should, because I think it would cause such a withdrawal from the medical system that it would force change almost instantaneously.
Should we eat bone broth?
Should we eat bone broth? Well, you know, there's always a new magical food, right? It's coconut oil, and then it's bone broth. And if you wait by the end of this interview, there will be something else that's come out on Facebook or whatever everybody's supposed to do. The problem with bone broth is that people have made ridiculous promises about what it can do that there is no evidence to support. And so what this is all based on is a bunch of storytelling. And the storytelling goes something like this. I had a pain in my knee. I started making and eating bone broth, and it went away. And I had, you know, a spot on my shoulder or a headache, or, you know, my cousin had this, and my best friend's boyfriend's mother's next door neighbor's coworker had that. And everybody's just telling all kinds of stories, and it gins it all up. But there's no evidence to support this, not a single study. And when you point that out, then people just scream and holler. You know, that's always my gauge of how much evidence there is when I say something about it and all people can do is swear at me. That's usually a sign you don't have much science to support what you're saying, right? But people become very defensive about their bone broth because they're convinced it's good for them, but not so much.
How do you lower blood pressure without medicine?
That's actually easy to do for most people. All right, and so you have to do a few things right. The first thing is you have to eat a good diet, because if your blood is all sticky and thick and viscous because you eat a lot of fat, well, that isn't going to help, right? So eat a low-fat, high-fiber, plant-based diet. Make sure you're hydrated. 60% of your blood plasma is water. And if you're dehydrated, your plasma shrinks, and you get that thick, sticky, viscous blood. And the vessels have to shrink. You can't have empty spaces in your blood vessels. So high blood pressure is one of the byproducts of thick, sticky, viscous blood making its way through narrowed vessels. So make sure that you're well hydrated. That is, by the way, one of the reasons why so many heart attacks happen in the morning. It's the most dehydrated part of your day. And then the third thing is exercise and maintaining a healthy weight. And for most people, if they do those things, they won't require medication. And the result happens pretty quickly. The drop in blood pressure happens pretty quickly. In fact, this is one of those conditions where a physician needs to be on board to monitor your withdrawal from drugs before you drive your car into a tree or end up comatose on the bathroom floor.
Do you recommend mammograms of any type? What does the science say? What about thermography?
Okay, population screening for breast cancer Completely ineffective. Does not lower the risk of dying of breast cancer. In fact, the risk that you will be harmed by regular mammography is significantly higher, 3 to 10 times higher, depending on what study you look at, than the chance that you will benefit. And the reason is that mammography is really good at picking up very tiny little masses, ductal carcinoma in situ, lobular carcinoma in situ. In situ means in one place, that are not really cancer. They're most of the time, almost 90% of the time, not going to develop into cancer. If anything, you could categorize them as risk factors for cancer with a whole lot of other risk factors by themselves, not going to cause cancer. Okay, so here's what happens that goes wrong. You have a bunch of women now, millions of them every year, who are told they have cancer. When you use the word cancer, the fact that it's in situ, everything else goes away. The only thing people hear is cancer. And the treatment that's recommended is ridiculous. We're going to do lumpectomy, increasingly mastectomy, radiation, follow-up treatment. This is ridiculous for a person who doesn't have cancer. And then the individual ends up in the survivor category. You're a survivor from having not cancer, but now you can race for the cure, and your whole life gets tied up being identified as a cancer survivor. And as if that isn't bad enough, all of this makes it look like the cancer industry is succeeding because you've lowered the death rate it's a statistical anomaly. It looks like you're lowering the death rate from breast cancer, but that's really not what happened. You diagnosed a lot of women without breast cancer, you treated them as if they had it, and then they go into the survivor category. They'll all be there 5 years later anyway, all right? Now what mammography misses is, we call them interval tumors. They grow in between cancer screenings usually, and they're normally not caught. Every once in a while you catch one, but normally they're not the ones that are caught. And you've probably had friends of your family that have been through this. The person says, I'm so shocked because in February I had a mammogram, it was clear. And then I noticed this lump in September and checked it out. Oh my gosh, it was stage 3 cancer. I can't believe it. So if early detection worked, you would have found that at its early stage in February. Okay, so you miss those cancers. That's why we haven't really seen a lowering of the death rate when you sort out all the people who didn't have cancer who were treated as if they have cancer. So again, women don't know that. I think it should be a requirement before they have a mammogram to say, I understand that the risk of harm is 3 to 10 times greater than the chance of benefit, but I want to have a mammogram anyway. I don't think many women would want to do it. You asked about thermography. Thermography is no better than mammography. Not a single study showing that it lowers the risk of dying of breast cancer. And to a certain extent, it is a bigger problem than mammography because it catches even tinier abnormalities. And what you do is you turn people into worried, healthy people, all right? And this can lead to the same type of overdiagnosis and overtreatment. So women say to me, well, what am I supposed to do? Well, if we were just honest in the healthcare field as a whole, what you would tell women is we don't have any early detection programs that work. So this concept that you're going to eat, drink, and be merry, have a mammogram every year or two, catch it early, and take care of it is false. So you're going to have to take care of yourself. You're going to have to do all the right diet and lifestyle. You're going to have to make all of the right diet and lifestyle choices that will reduce your risk as much as possible of developing breast cancer. And it's a very discomforting thing to somebody who drank the medical Kool-Aid and thinks that screening is going to save them from their poor health and habits, but it's the truth, and it's what we should be telling women.
Are we getting accurate health information, or is health information to the public censored in some way?
Well, health information that's given to the public, you have several problems with it. The first thing is the drug and device makers and the medical profession contribute so much to the media. Drug companies can advertise in the United States. Here in New Zealand, only 2 countries on the planet that permit it. So it's very difficult for a media outlet of any type to allow programming or interviews or like what we're doing right here, because if you upset your advertisers, if the drug companies pulled their advertising, there's not a network out there that could survive, right? So that's problem number 1. Problem number 2 is the media has become the laziest it's ever been. There are very few investigative reporters out there. They dutifully report what somebody tells them, sometimes with absolutely no evidence. And it's so bad. I said this in another interview recently. If the New York Times reported that I live in Worthington, Ohio, which I do, I think I'd run and check a few pieces of mail just to make sure that they got that right, because that's how little confidence I have in what they report about anything. Anything. Okay? I know it's kind of one of those fan the flames things when you start talking about the fake news, but the fake medical news is every bit as significant as the fake news that everybody else is talking about. Now, the third problem that you have is some of the people feeding the fake news, the stories, are very powerful people who have worked to censor information, take down documentaries off of platforms and that sort of thing. And I'll use names. Adam Schiff, who I think is one of the most despicable people in politics, actually sent letters, and I thought that before he did this, but he sent letters to Google and Amazon and other platforms saying that there should be no anti-vaccination information on these platforms. And so that's where the censorship began, and people have had their blogs taken down. I mean, this is very frightening because this is what despots do. You know, the things that despots do, like the Nazis, and history's full of this. You take away people's guns, then you censor the media, and then you get control of everything, all right? So we shouldn't let that happen in this country. And we should be, what should happen is everybody stops subscribing to this stuff. And if the media doesn't change, this is the only good thing I see in all of it. If the media doesn't change, they're going to render themselves irrelevant at some point in time, because right now they're fanning the flames with inflammatory stories that make people want to read and all that. But I think there's a growing exhaustion with it. It's like everything you people say is false, and I don't even think I want to pay $15 a month to read it anymore. So, you know. So that's what I think of the media and what's reported. So how does a person find out? And that a follow-up question that I'll ask myself, all right? How does somebody find out the truth? If people do, they find out about it at the Truth About Health conference, right? They seek it. They say, listen, I know I'm being lied to. My doctor didn't tell me the truth about this. The package insert on the drug didn't tell me the truth about that. The media is reporting lies about drug companies. It makes everything look better than it is. So I have to go searching. And they go online, and that's where the censorship is really significant, because one of the main ways that people sort stuff out and find things is the ability to search online. So that has to be protected no matter what. We should all be screaming about censorship there.
Do doctors have accurate information on nutrition? Should we take nutrition advice from doctors? How about from nutritionists and registered dietitians?
Well, let's start with doctors and nutrition. They don't learn anything about it in school. The question about should you take nutrition advice from doctors, I think that you should consider any advice from doctors the same way you consider advice from mortgage brokers and car salesmen, and take it under advisement, check it out on your own. And I'm going to tell you something about medical education I think we need to be talking more about. There's a big difference between the way medical doctors are educated and the way lawyers are educated. Okay, so think about legal education. I have a lot of good friends who are lawyers, and one of my employees, her husband was going through law school when she married him, so we got a lot of information about that. So when you're going through legal education, you're expected to disagree and dissent. You argue with your professors, you argue with your classmates. You look at a decision and the way that a court case went, and you say, I would have tried it differently. I don't think that they used the right statutory basis to file this complaint in the first place. If you are not good at arguing and dissenting and bucking the system, you can't get out of law school, and you certainly wouldn't make a very good lawyer. Now let's contrast that with medical education. It's about compliance. You have to comply, all right? Important to comply. If you raise too many questions, asking questions, why are we giving these drugs instead of using nutrition? You're not going to get out of there. And so what happens is you end up with people who are less about thinking. Not that they're not smart people, they are. But the whole training process is to teach them not to think outside the box and not to think for themselves. So it's very easy to program people like this to think that drug companies are good people, or good companies. Their reps are good people. Prescribing drugs is the thing to do. Nutrition is for dietitians. It's taught in a very stupid way, actually, what little nutrition education they get. Like, what do you do if the blood test shows low sodium levels, not necessarily the global sense of what kind of diet should people be eating. So I think all advice from doctors should be taken with a grain of salt, just like you do every other person who gives you information about anything. Dietitians, same thing. Very interesting thing happened. I was in a movie called Diet Fiction, and one of the people in the movie who I knew is a dietetics student who only agreed to be in the film if the face and voice could be altered to the place where this individual could not be recognized. And the reason why that concession had to be made was because the person said, I'm a third-year dietetics student, and it's very important that I say what these people want me to say. And if I were to be caught on camera dissenting with them, I am sure they would find a way for me to not graduate. I think that says it all. So we're turning out dietitians who don't think. There are some notorious exceptions. Again, great dietitians. I work with some of them, all right? But those are the exception, not the rule. These are people who said, I was taught to be compliant, but I'm not going to do it. Other people, most of them in fact, I was taught this way and I'm going to stick with it. Health professionals are sort of like the media, remarkably not curious about why what they're doing isn't working, which you'd think that they would be.
What do you recommend for women experiencing low sex drive who are premenopausal, going through menopause, or postmenopausal?
Well, it depends on what the cause is. You know, when you ask a broad question like that, there are a lot of different answers. So what are some of the reasons why women would have a low libido? Fatigue, not taking care of themselves. You know, if you're 50 years old and you're 40, 50, 60 pounds overweight and you eat crap and you're dehydrated and you don't exercise and you don't sleep well, and you're taking 19 supplements because somebody told you that that would fix all that, okay? Maybe you don't feel like doing much of anything when it comes right down to it. A lot of women I meet who have low sex drive have low drive for everything. They're just shuffling along, dragging their bodies through the day every day without a great deal of enthusiasm for anything. What kind of relationship do you have with your significant other? That's another thing. Sometimes it's not about libido physically as much as it is, we don't have a very good relationship, so who cares, you know? Sometimes it can be about hormones, but that usually comes back to the weight, the diet, you know. So the key is you get yourself in optimal health. People who are optimally healthy, love their partner, and have a great life usually don't have a lot of problems with sex, okay? One last thing I'll add for women is that there's a great product called Gen Lubricant. It's been on the market forever. It's not hormones, but it plumps up vaginal tissue. And so some vaginal dryness is a function of aging, and it's easily resolved with a product like that.
How do you prevent and treat urinary tract infections?
Urinary tract infections have a variety of causes too, one of the biggest of which is dehydration. Another problem is once you have a UTI, there are various ways to get them, but including sexually, they can be transmitted sexually. But one of the things that happens is women have a UTI, and then they take an antibiotic, which wipes out all their beneficial bacteria, which makes it easier for the next UTI to develop, and so on and so on. So the first thing is stop the chronic antibiotic use and use plant antimicrobials to address the UTI. Drink a lot of water, and then get some cranberry juice, not from concentrate, all right, which is so sour that it'll wrap your lips right around the bottle, right? So get some raw honey, which also has antibacterial properties. And just so you know, there are actually medical journal articles showing that raw honey can be used as an antibacterial substance for either topically or systemically. So take some, not from concentrate, cranberry juice, sweeten it with a little bit of raw honey, the stuff you're getting from the beekeeper, and you can usually overcome that infection, and then use strategies like urinating right after sex and you know, eating a great diet, making sure you drink 64 ounces of water a day, and so on.
What do you recommend for people with acid reflux?
Acid reflux is usually pretty easy to treat as well. Lots of reasons for it. Diet is a big part of it. Weight can be a big part of it. That's one of the reasons why people who are really overweight sometimes have to sleep with the bed at an incline, or they can't really like lay down on the couch. They have to be at an incline because the weight pushing up can weaken the esophageal tube. Constipation can contribute to it. So you change the diet, lose the weight. Once in a while you'll find out that somebody has a particular food trigger that gives them heartburn that doesn't affect somebody else the same way. So for example, I drink coffee and it doesn't cause reflux. Somebody else has 5 sips of coffee and they can feel the burning. So you can do an elimination diet if needed to figure out if there are some of those triggers. Most of the time that works, fortunately. One of the worst things you can do to treat it is take proton pump inhibitors and that sort of thing. And one of the reasons is that, first of all, they're remarkably ineffective. one of the things people don't know is they were approved for short-term use. In other words, the whole idea of a PPI was supposed to be to keep damage from the esophageal tube and ridiculous discomfort while you lost weight and changed your diet. So you take this for 6 weeks and stop. The problem is that's not how they're being used. People take them for years. The rebound acid from withdrawing from these things, it's so horrific. People have to go right back on them. So you have to withdraw from PPIs really, really slowly over a period of time to address that rebound acid production. That's the worst way to treat it. Best way to treat it is lose weight, change your diet.
Is it safe to get breast implants? Why or why not?
You know, breast implants have never been a good idea, but recent research has shown that they do increase the risk of cancer. Now, the risk is small, but the problem is it doesn't feel small if you're the person who ends up with the breast cancer, right? So, it's also an avoidable risk. Like, you know, I call it getting hit by a bus. I can be really careful about driving, but I can't control the hit by a bus. I could do everything right in life and still get cancer. That's the thing coming out, you know, from left field. But this is a controllable thing. It's like fastening your seatbelt, right? You can not put the implants in or take them out. And the fact that these were allowed to be used for so many years before research was actually done to show that they were a problem goes back to what we talked about earlier, which is nobody's paying attention to stuff from a regulatory perspective.
What is fibromyalgia and how do we avoid it?
Fibromyalgia is a constellation of symptoms that are characterized by symmetrical tender points where the person actually feels a great deal of pain. Often fatigue, irritable bowel is often a component of it, headaches. It's a disease that's predominantly affecting women rather than men, although some men have it. And the easy part of resolving it is that most people with fibromyalgia have lots of room to improve their diet, weight loss, all the things that I talk about all the time. But there's a psychological component to this also. And when I say psychological component, I'm not talking about you made it up, it's all in your head. I'm talking about that often emotional pain, anxiety, trauma is reflected in body tissues. And in fact, there was a great doctor in New York. His name was John Sarno, and a documentary about him has been made. He was on the teaching staff at a university here in New York and recognized that so many people weren't getting well from physical pain. And he had an idea that this was due to emotional stress and anxiety and that sort of thing. So he started a program, he called it knowledge therapy. You can read about it in his book. Knowledge therapy was sessions where he would say, cut it out, bend over, pick stuff up off the floor, your back doesn't hurt anymore, stop babying yourself. You're going to turn yourself into an invalid if you continue to behave this way. And it sounds kind of hard-hearted, but a lot of very famous people underwent knowledge therapy. Howard Stern was one of them, Senator Tom Harkin. And I've met patients of his when I've been here in Long Island for fundraisers and that sort of thing who've said, this guy saved my life. I was on my way to becoming an invalid from pain, and he told me to stop this. And I learned, I took a good look at the emotional stresses and traumas that were influencing this. So you have to address that too. It's an important part of it, the psychological part of it.
What does the research show on stents and bypass? Why do doctors recommend these procedures?
Well, doctors recommend things they were taught to recommend. Back to what I said, not independent thinkers. You know, stents and bypass surgery can be they can save lives. If you end up at the hospital in the middle of your myocardial infarction, what you want is a good interventional cardiologist. So those are times when stents and bypass surgery may actually save your life. But the type of voluntary procedure where we're sitting in the doctor's office today and saying, how about if we schedule it for 2 weeks from Friday? Those are the procedures that are generally useless. And there are a couple of reasons for them being useless. One is that cardiovascular disease is systemic. If you have it in one part of the body, you've got it everywhere. So the idea that you're going to do something with some vessels close to the heart and ignore the rest of it, you know, bodies are integrated. I mentioned that earlier. People often maintain their bad habits. So that's one of the reasons why there's very little risk reduction in the voluntary setting it up in advance bypass or stent. We now have a few studies, not just one, but a few, where stents, there have been actually double-blind placebo-controlled studies with stents. So how can you do that? Well, you put stents in some people, you do the angioplasty, no stents, and other people, no difference in the outcomes between the stented and the not stented group. So are stents always useless? No. Bypass always useless? No. But we do about 500,000 of each of those procedures here in the United States every year. We probably should do 15 to 20,000 of each. But the biggest reason why it's not going to change anytime soon is these cardiac cathedrals that have been built as part of every medical center. And these medical centers can't stay in business without the cardiology, interventional cardiology. So it's a big business, most of which is unnecessary and not helpful.
Which other medical procedures would you consider necessary, and which would you say the risks outweigh the benefits?
Okay, so when you're making a decision about anything related to healthcare, including procedures, the first thing we'll do is we'll exempt emergency. I mean, I don't know about you, but if I'm in a car accident and I'm bleeding out on the street, don't give me a copy of somebody's book and a baked potato, right? And we really don't want to have long conversations. Stop the bleeding, give me a drug, I'm in excruciating pain. So you let people save your life. And I think that's where Western medicine is so remarkable. If something like that's going to happen to you, you want to be here in the United States, right? With everything else, what you want to look at is what is the risk I'm going to take and the benefit I'm going to get in the long term. Because a lot of stuff looks great in the short term, it just doesn't have much long-term benefit. And then another question that an increasing number of people have to ask, because they are taking control of their health, is mitigating that data with questions about how much are you like the cohort. So let me give you a simple example. I'm 63 years old, and let's just pick a number out of the air, that I'm being recommended to have a procedure that reduces the risk of something by 20%, and that sounds kind of significant. And there are side effects I need to take into consideration, but I'm 63, ideal weight, athletic, vegan, hydrated, happy camper with life. How much are the people who benefited that 20% reduction? How much am I like them? If them are the general public, I'm nothing like the general public who are overweight, eating cheeseburgers and french fries, sedentary. So if the benefit is 20% for them, it isn't going to be a 20% reduction for me because I'm starting at a lower risk. And that has to be factored in because it means that significantly more things are not useful to people who are like me.
Is it safe to be a plant-based athlete, triathlete, or mixed martial artist? Do you get enough protein?
Yeah, it's safe. It's more helpful. It actually makes performance better, easier if you're a plant-based athlete. And there are a lot of reasons for it. The first one is that inflammation is deadly to athletes, and there's going to be some of it from the hard working out. But inflammation can be caused by diet alone. Animal foods, for example, are high in arachidonic acid, which is a precursor to inflammatory hormone production. So to the extent that inflammation can cause more injuries, keeping it lower can be helped by being on a plant-based diet. The protein issue, really, higher protein intake doesn't make you a better athlete. And gosh, if you could eat protein, if muscle was built in the kitchen, we'd live in a land of Arnold Schwarzeneggers. Look at the way people eat in this country, right? Muscle and athleticism is not built in the kitchen, it's built in the gym. We have very good studies showing that if you take a group of people and they all do the same exercise training program, give this group of people 34% of calories from protein, give this group of people 17% of calories from protein, there's no difference in where they end up. We have very good studies showing that it's not the protein, it's the training program. For example, if you take a group of people, and there's at least one research study using these specific numbers, and you put them all on the same exercise program, and you give this part of the group 17% of calories from protein, this part of the group 34% of calories from protein. At the end of a certain number of months, there's no difference in the two because it wasn't about the protein, it was about the athletic training program, okay? Another thing to keep in mind is that glucose is the energy currency of the body, and it's a byproduct of carbohydrate. The body, just like your car has to have gasoline, like you can't put, there's only so much Pepsi you can put in the tank. It really has to have gasoline to operate, right? There's no substitute. It's the same thing for the body. Now, if you don't provide enough glucose through high carbohydrate eating, the body's going to get it from somewhere. And one of the easiest ways to get it, unless you're doing like an ultra marathon where you're going to burn up fat stores, but the easiest way to get it outside of those situations is to take lean muscle mass and extract, burn it up so you can get some amino acids like alanine that very easily convert to glucose. So actually a high carbohydrate diet is muscle sparing, right? Which surprises many, many people. There is no protein deficiency in westernized countries. It's difficult to not eat enough protein. It's difficult. If you're eating a calorically adequate diet, you'll get enough protein. One more thing I'll mention, because this is a way of explaining it that helps people understand a little bit. So I mentioned glucose is to the body like gasoline in the car. All right, so you put gas in the car, you drive so many miles, however you can on a tank of gas, you must get more gas. And so you eat sweet potatoes and rice and beans and all this stuff, and when the glucose is gone, you have to get more food, right? Very similar. Now, protein is different. Protein is actually like a fountain in downtown Columbus, Ohio. Let's say our hypothetical fountain has 500 gallons of water in it, and it circulates all day long, really pretty downtown fountains. Okay, every morning, the city workers don't go in and put 500 more gallons in, do they? They put 20 gallons in. That's what's splashed out or evaporated. That's how protein works in your body, because it's all broken down into amino acids, which are used again and again and again. It's the amino acid pool. So how you find out how much protein you need to replace, because the amino acids can only be used so many times, you do urinary excretion studies. Because when an amino acid is broken apart for excretion, it releases nitrogen. And nitrogen throws off toxic byproducts like ammonia and urea, which is why you don't want to eat too much of the stuff, right? But the nitrogen is excreted. And you can get a pretty good idea of what the average human is actually needing to replace in terms of protein. This will blow your mind, but it's like 2.5%, 3% of calories. Very low. So if you lived on Twinkies, you'd get enough. Not that I'd recommend it, but you still wouldn't be deficient in protein.
Should we eat fish oil? Does it help reduce heart disease?
Fish oil does not help reduce heart disease. And this whole omega-3 fatty acid thing is just, it just won't die because people are so invested in it. But you'll find these tiny little studies out there, not particularly well done, that'll show a minor benefit. But when you do meta-analyses where you're looking and crunching lots and lots of data, there's just no benefit. So you just have to eat a good diet. And I think the omega-3 issue, which is what the fish oil thing is based on, it comes from this change in our diet. I think it's it has been a negative change in our diet, where we used to eat a diet where the ratio of omega-3 to 6 fatty acids was 1:1 to 1:4. You ate as much as or a little bit more of omega-6, which comes in land animals and polyunsaturated oils. Well, what's happened is land animals and polyunsaturated oils gone up a lot in the diet. So this ratio now is like 1:25 to 1:50. Well, the answer to that is not to take supplements to normalize the ratio, it's to change the diet to normalize the ratio. So this idea, and it's still pretty pervasive, that you can do bad things for your health and take a pill and fix it, gosh, I wish that was true, because my days in the office would be so short. I mean, we just have everybody lined up, here's your fish oil, here's your this, here's your that. Wouldn't have to have much conversation, learning new skills, but it just doesn't work. It's a pipe dream.
Are there any conflicts of interest in the cancer industry? Can you explain that?
The conflicts of interest in the cancer industry are as bad, maybe worse in some respects, as in the rest of the medical field. The worst part about it is that oncologists can sell, we wouldn't think of it that way, chemotherapy drugs in the office and mark it up and make money. And it constitutes a significant percentage of their office revenue. Now, I want to be clear about something. I'm a capitalist, and I'm not necessarily opposed to that, but it should be disclosed, because then it might help a person understand why their oncologist is negative about anything but the chemotherapy. And I don't think oncologists show up at work every day and say, gosh, I really want to put a room addition on my house, so how much chemotherapy do I have to sell? But it's a bad system. It takes good. You've heard about the putting the good apple in the bad barrel, right? So medicine is a bad barrel, and we put good apples in the bad barrel, and they get spoiled, and then we're shocked about it, right? So I think it should be disclosed because it's a horrible conflict of interest. When you come into my office, we have a store and we sell foods that we make and this sort of thing. And I think almost any thinking person knows that I make a profit on that. So it's fully disclosed. But can you imagine if I disguised all of that and somehow was keeping the fact that I make money on this a secret? It's a nefarious, it just is not right, okay? Even a person who is a good person in that system becomes a suspicious person because it isn't disclosed,
What does the science, research, data, and studies say about the safety and effectiveness of chemotherapy?
Well, chemotherapy is a difficult topic from the standpoint that you have these polarizing views. Actually, the cancer industry and cancer treatment is polarizing. So the best treatment, in my experience, is when people, first of all, make evidence-based decisions. And there are two types of decision-making in cancer that are bad. One is, I'm just going to do what this genius at the medical center at the university says because look at all those diplomas on his wall. He must know everything, which that really doesn't mean anything. You need to check it out. It's like going into a car dealership and the guy has sold more cars than anybody else in North America. I'm really glad. He probably does know a lot about cars and he's a hard worker and all that, but that may be a reason to check him out a little further or check out the car a little further, right? So the first thing, that's a bad way to make decisions. Another one is in an emotional state where you're being pressured by family and friends to do what the genius at the medical center said because after all, he went to Harvard, right? So the first thing I tell the cancer patient is settle down. Let's get past the emotional part of this, get rid of a little bit of the charge, and let's look at data. Now this is where what do you think of chemotherapy and cancer treatment comes in. Indiscriminately administered chemotherapy for many types of cancer doesn't work at all. In fact, it may finish off the patient earlier. But targeted chemotherapy, smaller doses that might be timed with intermittent fasting to potentiate the chemotherapy in conjunction with a whole treatment plan of things that, because it's about everything. It's about your emotional state. It's about why did you get this cancer? If you don't change your diet, you probably could get it again. If you don't look at the emotional underpinnings of cancer, most people think they got cancer for a reason if you question them enough. So you might have to fix that. If you're a person who's historically been always the giver, I do everything for everybody, but nobody does anything for me, maybe that's the thing you need to fix, right? And I'm not saying ignore the biological cause of the cancer. You have to do that too. But cancer is a complex disease. It's only going to be solved with good, integrated programs that look at the totality of you, how you got this cancer, and how you're going to get over it. And chemotherapy, some chemotherapy may be a part of it, some radiation, sometimes surgery, sometimes not. Again, each thing evaluated, looking at risks, benefits, what are the outcomes, or should I be looking at something else? Now, this is why this becomes so difficult. I get hate mail from people who say, I can't believe you would ever recommend chemotherapy. Well, when evidence shows that it's the right thing to do, you recommend. In other words, stop trying to pick a camp. How about we just let evidence drive the decisions? Take the labels off of everything. Traditional, alternative, that doesn't mean anything to me. It's all about making evidence decisions.
Are statin drugs helpful? What does the science say about the pros and cons of statin drugs?
Statin drugs are like a lot of drugs. They're helpful for a particular group of people. So it's the widespread prescribing of statin drugs. I think your number needed to treat in the general population is something like 400, which is ridiculous. That means 399 people don't benefit from taking the drug. It's all side effects, no benefit. But if you are a person who has a condition called familial hypercholesterolemia, where no matter what you do, no matter what you eat, no matter how careful you are about everything, your cholesterol is 380, you're going to benefit from taking a statin drug. So the key is, and this is another one, you don't want to throw the baby out with the bathwater. Statins aren't all bad. They're just all bad for most people. So you have to figure out, are you in the group of people who benefit? One thing to keep in mind about any drug is that the smaller the abnormality, the less likely you will benefit from taking a drug for it. So whether it's cholesterol, in which you would prescribe a statin drug, or blood pressure when you would prescribe an ACE inhibitor or a beta blocker. Minor abnormalities, you're probably not going to benefit. It's the gross abnormality that really benefits from drugs.
What do you think of the USDA and USDA dietary guidelines?
Well, I've been involved in testifying in front of the USDA Dietary Guidelines Committee, which is generally populated with conflicted people. They have a couple of people who aren't conflicted, don't work for the agricultural industries or food companies and that sort of thing, don't take research money from them. The problem is an institutional conflict of interest. That's the big problem. So you've got an agency that was set up under Abraham Lincoln's administration, by the way, to be an advocacy organization for farmers and to teach them better farming practices. They actually started with good intention, and they did good work because at the time what was happening is farmers would till the land, and they really weren't very responsible about land usage. And then when they torch the land, they move west. Well, you move west enough, you end up in the Pacific Ocean and we all starve. Not good, right? So the USDA did some very good work in the beginning to keep that from happening. But someplace along the line, they decided that they were going to be the organization or agency that would develop dietary guidelines for Americans. And the institutional conflict is your goal is to help farmers. That's how you were chartered. Now you're going to tell people what to eat. Well, if you tell the truth about what to eat, you might actually tell people not to eat some of the things that your actual clientele, the farmers, produce. And that's never going to happen. They're always going to cave to the interests of farmers and special interest groups. So the guidelines they're getting better incrementally, but they could be made better in one go round if we just threw all that problem out and dealt strictly with what the science shows about the best diet to eat.
Have any new credible studies come out that have proven red meat and processed meat are safe to eat and are good for our health?
No, and that was a myth. Last year, the Annals of Internal Medicine, which has become, it's like the National Enquirer of medical journals. They're all pretty bad, but this one's like the bottom feeder. And there's some reason to believe that the reason the journal prints this garbage is because it draws a lot of attention to them, and then their standing in terms of goes up in terms of medical journals. But those studies, I analyzed those studies, and I wrote an 8-page article about it. And the studies actually showed that reducing red and processed meat would save 353,000 lives in the United States alone, and in terms of deaths, and reduce the incidence of cancer, diabetes, heart disease. So, you can report things differently. The same data can be reported differently depending on how you read it. One author agreed with me, by the way, and he tried to stop the publication of the articles. He was involved in the analysis, and he said, I was actually involved in crunching the data, and it would be inaccurate to report that there's no need to decrease the intake of red and processed meat. Interestingly enough, the Physicians Committee for Responsible Medicine has filed a complaint with a district attorney in Pennsylvania alleging reckless endangerment, that the journal this time had gone so far in publishing garbage without the disclosing conflicts of interest. They never forced the lead author to disclose his conflicts, which were huge. But giving the idea that doing this very dangerous thing, eating red and processed meat, is okay. So we'll see what happens, but I'm not a particularly litigious person under normal circumstances, but I'd love to see that go through the courts. I think it would be a very interesting case, and it might make medical journals and the media more responsible.
What do you recommend for whole food plant-based eaters who complain of gastrointestinal pain?
Well, you can be a whole food plant-based eater and still have gastrointestinal pain for a variety of reasons. Maybe you've taken antibiotics and wiped out your gut microbiome. Maybe you were still eating a high-fat diet. I've seen people eat exclusively plant-based diets with 40% of calories from fat. You're going to be uncomfortable regardless of where the calories are coming from that way. You can still be overeating. Some people don't realize that people have different tolerance for some foods. And I'm not talking about this food allergy nonsense that a lot of people get into, but I'll just use myself as an example because it's easy. I really love cabbage, and I can eat about as much cooked cabbage as I want to. But when I eat raw cabbage, like the red cabbage they put in salads, which I love, I have to be really careful because if I eat too much of it, I look like I'm pregnant very quickly, right? So do I eat red cabbage? Yeah, but I'm pretty mindful of that so I don't end up uncomfortable. That doesn't mean cabbage is bad for me or plants are bad for me. It's just a little thing for me because I watch people at my office eat a half a head of it. It doesn't bother them, you know. The same thing could be true with beans. You know, some people can eat, 3 cups of beans. Other people, about 3/4 of a cup is the limit. They start to get pretty gassy. So you have to look at that type of thing too. But you may have unresolved gastrointestinal issues that like your microbiome isn't going to fix itself. You have to take probiotics to do that. So lots of reasons why that could be going on.
In Chapter 5 of Food Over Medicine, what did you mean by the dietary establishment?
The dietary establishment is this incredible partnership between government, USDA, for example, food companies, agricultural organizations, dietitians and nutritionists and doctors who all partner to keep a narrative going that basically says you need animal foods for protein. Moderation is the key. And all of these statements are designed to either promote a particular food, dairy builds strong bones, right? Or to promote a narrative that says you can essentially eat anything as long as you do it in moderation, which is insane because if you eat a diet that is comprised of all bad stuff in moderation, it adds up to a bad diet. And while you may have only had chocolate one time and fast food one time and 3 soft drinks this week, and you add it all up and you just were not eating a health-promoting diet. And the reasons for this, all of this, is economic. The ag businesses are very wealthy, and they buy academic centers in universities. They buy healthcare professionals to speak for them. In fact, back to the question about red and processed meat, there was an article it wasn't red and processed meat. There was after the Dietary Guidelines Committee meeting, one of the things that came out from a lot of the experts is you have to eat animal foods for choline. And so shortly after that, an article appeared in the British Medical Journal written by a nutritionist who echoed this. And of course, it's in a medical journal, and she's saying choline is important. But aside from the fact that her article was easy to take apart, she was on this part of this organization called the Meat Board. And I went to her blog and I read her dietary recommendations. She's associated with people who pay her for this stuff. And she says, you should eat slab bacon instead of streaked bacon. I mean, if you looked at her dietary recommendations and where she was funded, you could see why she was saying this. So this is the type of thing that goes on to keep the narrative going that you need protein, you need particular foods, and all of them are good as long as they're consumed in moderation.
What do you recommend women going through menopause do to relieve any physical or emotional discomfort or pain that they're dealing with?
Well, menopause is not supposed to be a disease. And just think about this. When we were hunter-gatherers and cave dwellers and that sort of thing, if menstruation and menopause and pregnancy were all causes of disability, we would have died out a long time ago, because you really didn't have the option of saying, I'm not running from predators today because I'm PMSing, right? So this whole idea that your hormonal fluctuations and this sort of thing is, you should not notice that this is going on. So when you're going through an uncomfortable menopause, it's usually the culmination of having had hormone problems for a long time, might have been mild, might have been serious, and not taking care of yourself over a long period of time. So when women are miserable because of menopause, you look at diet, alcohol consumption, it's a big part of it. Oral contraceptive use throughout your reproductive years can be a contributor, weight status. So now you have to start living your life like a healthy person so that menopause can be a non-event. And women really hate when I say this, but you know what really relieves hot flashes more than anything? Exercise. Really vigorous, hard exercise where you sweat like crazy, like 90 minutes in our hot yoga room will help a lot every day until you get over, and you'll lose weight, and along with diet and all those other things. So this is just really a lifestyle thing. It all comes down to what we talk about as the solution for everything.
Do you recommend biopsies? And if not, why? What does the best science say about the benefit of biopsies?
Biopsies are a bit of a problem, and they're risky. And the reason is because when you disturb the capsule, assuming that, and sometimes you don't know this, but assuming that it's contained, when you pull the cancer cells out, you sometimes see the development of cancer right along the track of the biopsy. We even have some evidence that when you're disturbing the cancer in surgery, you end up with circulating tumor cells going up. In other words, you're only operating on this little body part right here, so how are the cancer cells circulating in the bloodstream? So I wrote an article on this, about this not too long ago, and the problem that it presents is that many doctors, many medical centers won't perform surgery on even what appears to be a tumor with clean margins without first getting a biopsy, which may actually be the thing that takes a localized cancer and turns it into a systemic or metastasized cancer. And when I started looking at this, I'll tell you what happened. It's an interesting story. I was listening to a lecture, and this very, very good researcher who I respect brought this up, and I made a note to myself, I need to check this out. I never repeat what somebody tells me. I always check it out on my own. And so I started looking into it, and what I thought I was going to find was a study. And then I might have still reported it, but I would have qualified my statement by saying, I found a study. It was done at this, University Medical Center. It's certainly provocative, and it might make us all think about biopsy. That's not what I found. Overwhelming evidence. And so it's a much bigger concern, and it's very concerning because I find myself in so many situations with our members where they're basically saying, look, I don't want to have a biopsy, just take this thing out and then we'll let the chips fall where they may, and doctors just refusing to do it.
Are doctors refusing to do it because of the litigious society we're living in?
Doctors refuse to do things based on litigious society. The irony of that is I read an article recently identifying the reasons why patients sue. You know what the leading reason is for patients to sue a doctor? I was not fully informed about this, and I wouldn't have done it if I had been fully informed. So the thing that they're most afraid of, the response to the thing that they're most afraid of, is actually causing the thing that they're most afraid of. So there is some CYA medicine going on. In healthcare, you will rarely get sued for doing too much, but you can often get sued for not doing enough. And there's always some family that, I remember seeing something, I was not a fan of this guy, Gonzalez, the guy in New York who had a supposed cure for pancreatic cancer. And a lot happened with his stuff. I mean, he was going to do a clinical trial, and they had to sue to get it to stop because they weren't enrolling the right type of patients. It's the normal ridiculousness that goes on around these things. But in any case, I saw a special on one of these news shows about Gonzalez. And he was treating pancreatic cancer patients, and the death rate's high. I mean, very little survival even at 5 years. And so a person who might go see Gonzalez probably knows that he or she isn't going to live, so why wouldn't you try something else? I don't know if that's the right thing to try, and that's not what this particular conversation is about. But when the person dies and then their family's on 60 Minutes or whatever saying, my mother would have been better off, she'd still be with us today if she'd been at the medical center doing what the oncologist told her to do, that's patently false. It's that overconfidence in medicine that leads to that kind of thing. So was Gonzalez right? I don't know. But he certainly wasn't killing cancer patients because he was treating people who were going to die anyway. Any of them that lived would have been a surprise, right? So yeah, we live in a litigious society, but a lot of it's induced by medicine, much more than by consumers, actually.
What do you recommend for people who have eczema?
Eczema is a form of allergy, actually. It's usually food-induced. And it's also, a reason to pay attention to it is people with eczema, their immune systems aren't behaving, and they often end up being autoimmune patients. So good to treat it before it gets worse, but it usually responds well to dietary change, getting rid of dairy products out of the diet, sometimes restricting gluten intake.
How do you know if your bone density is okay or not, and what tests do you recommend for testing this? What foods, supplements, drugs, or lifestyle choices help and hurt with bone density?
Okay, so your bones were meant to live as long as you do. And what people don't realize is that, many people, is that just like all the other cells in your body, your bone cells turn over every year. You get like a whole new skeleton, right? So how do you make that happen, keep that bone healthy? The first thing is you eat an optimal diet, exercise. okay? Because exercise, movement, weight-bearing exercise stimulates the bone remodeling process. Get out in the sun, and your body will make vitamin D, which is important for bone health, but taking the supplements doesn't help your bone health at all. Make sure your gastrointestinal tract is in good working order, because if it's not, nutrients, including calcium, that are needed for bone building won't get in. So drugs that damage the microbiome or the GI tract, or diseases, celiac disease, taking steroid drugs, these are things that can lead to osteoporosis because you're not absorbing nutrients from food needed for bone building. So that's the thing. There are no tests that I recommend for measuring bone density, and the one that's used most often, DEXA, is ridiculous. I mean, this is a test that measures loss of bone mineral density, which is a normal function of aging. Women lose bone mineral density more than men because the demands of childbearing and breastfeeding are significant on the skeleton. So we start with higher peak bone density, lose more of it after menopause. So only the medical profession could promote a test that tells you that you're getting older, as if we didn't know that before we went in, right? That's pretty well universally accepted thing.
What factors contribute to macular degeneration?
Macular degeneration is, and diseases of the eye in general, have a lot to do with nutrition, because it's related to cardiovascular disease. And most people eat a diet that damages their cardiovascular system. Well, a couple of conditions, both diseases of the eye and erectile dysfunction, happen because, and often they're the first sign of cardiovascular disease, because you have these tiny little micro vessels that are delivering nutrients and stuff to the eye and also to the penis. So what's good for the heart is good for the eye, and good for erectile dysfunction, all right? And good for the brain also. I'm giving a talk on that today. Another factor that is an issue is type 2 diabetes and uncontrolled type 1 diabetes, factors for developing conditions of the eye. So in a general sense, we could say if you want to protect your vision, eat a health-promoting, low-fat, high-fiber, plant-based diet, exercise, stay hydrated, all the things that we're talking about, going back to the idea that systemic, working on your body from a systemic standpoint will protect all the parts of the body systemically.
In Chapter 6 of Food Over Medicine, what did you mean by managing your doctor?
Well, the way you manage your doctor is the way that you manage buying everything else, okay? You know, I teach by analogy. So I have been in the building I'm in for, 15, 16 years now. And I have a great landlord. Not many people say that about their landlord. I like my landlord. He takes very good care of this property, and every time we renew the lease, he does new things inside my space and all that. But when it was time for lease renewal, I took it home and read it, the lease. Okay. Now, I like bread, but I signed my name to $1 million. So I'm going to read that lease before I put my name on it, just to make sure there isn't something in there that's like, whoa, right? And there wasn't, but you still read it, right? When you buy a blender, people get online, they look at consumer reports, right? Financial advisors, you check them out, and you look into a mutual fund on your own. I mean, it's your money, right? So we have very good strategies for checking out other things that we do. When I bought my house, I looked at comps on the street. I don't want to overpay for the house. You never want to be the most expensive house on the street, right? So looked into that. Okay, so then people walk into a doctor's office, it's like they go brain dead. All the good buying habits they have for everything else they've ever done in their life, which actually turned out pretty good most of the time. I mean, we can all look back and say, well, I shouldn't have done that. But for the most part, most people who think, look into stuff, end up pretty well. You go to a doctor's office and he says you need an $80,000 surgery. I've scheduled it for next Thursday. And we go, okay, right? And that's really bad. So again, if it's not an emergency, one of the questions we teach our members to ask, say to the doctor, you want me to do this? I'm going to take that under advisement. Please give me the research studies showing that this is a good idea for people like me. I'll read them. I'll do some research on my own. I'll get back to you and let you know what I'm going to do. And a doctor that gets upset about that, you need to get rid of him or her anyway, because you cannot have a relationship with somebody who says, do what I say, or we can't do this anymore.
Is chicken a better choice for our health than beef? And how about fish?
Chicken and fish are not better than beef and pork. The key if you're going to continue to eat animal foods, we don't really have any evidence showing that that in itself is a dangerous practice, but it's dose dependent. If you take a look at all the healthy populations around the world, the blue zones, there aren't any of them that are indigenously vegan, right? But what they have in common is their consumption of animal food is a tiny, tiny percentage of their calories. They're eating mostly plant foods. So if we were in Ethiopia right now, we'd be having a little bit of goat meat, but it would be served in a dish that has lots of tubers and vegetables and rice and that sort of thing. If we were eating in rural China, we might have some egg in the soup, but it's mostly, plant food. But it really doesn't matter what type. What matters is how much of it you're consuming. So one's not better than the other. It's the dose that counts.
Do you recommend men get a PSA test, and what is a PSA test?
Prostate-specific antigen is advertised as a marker for prostate cancer, but it's not. An interesting side story, Dr. Richard Ablin is the person who discovered PSA. He's the researcher who discovered it. It's a good friend of mine. And he wrote a great book called The Great Prostate Hoax. I recommend all men read it. He's been a presenter at our conferences before. And he's been trying to tell people for many, many years, decades, that it's not a marker for cancer. A lot of things can affect your PSA level. Riding a bike the day before, sexual activity the day before. Diet affects PSA quite a bit. But the error rate, or the false positive rate for a PSA test, is about 78%. And then it gets worse from there. So it's not a marker for cancer, so we should stop doing this. But what it leads to is biopsy. And the problem with the biopsies is that men tend to develop prostate cancer as they age. Like in Japanese autopsy studies have shown that almost all men in Japan die with prostate cancer, not of it, okay? So here's what I'm getting at. If you do a PSA test that's elevated for any variety of reasons on a 75-year-old man, and you do a biopsy, we already know he's got prostate cancer. The question is the prostate cancer going to kill him, or is he going to die of something else with the prostate cancer? So when you start talking about prostatectomy, which is often what's recommended in some of the treatments that render men impotent and incontinent, it's gross overtreatment. In fact, according to Dr. Ablin, 1 million men in the United States have had a prostatectomy that was not warranted. Okay? So bad test, not an accurate marker, was never designed. What it is good for is monitoring patients who have been diagnosed with aggressive prostate cancer that really is cancer. And there are some good reasons to monitor PSA tests then, but as a screening tool, it's absolutely useless.
What impact does eating eggs have on cholesterol levels and our health?
Eating eggs has a direct impact on cholesterol levels. The addition of even one large egg a day, just one, can be noticed in cholesterol tests within just a matter of a few weeks. Okay, so people will say, but there are studies that show the opposite. And let me tell you what happened there. Back in the late 80s, early 90s, the government made a decision to stop doing testing for cholesterol, food and cholesterol. And they did the same thing with smoking, not because they think that cholesterol and smoking aren't important, but the government doesn't have unlimited resources for research. And they legitimately said, look, we have a pretty big body of evidence showing that diet affects cholesterol. High cholesterol is a risk factor for heart disease. And I don't think anybody's going to make an argument that smoking is really good for you. We're not going to make any interesting discoveries there, so we're going to stop funding those kinds of studies. Well, the Egg Board, which is pretty aggressive about promoting eggs, and that's their job, that's what they do. But they seized this opportunity and they started conducting studies of their own. And one of the things that you have to be very careful of is study design. Because in some of these studies, what they did is they got people who were already eating a diet really high in cholesterol. And there's something called a cholesterol saturation point, where you're eating so much cholesterol, and your cholesterol may be high, but the thing is, adding a little bit more cholesterol isn't going to make it higher. So you can claim, well, we gave these people, an extra 7 eggs a week. Their cholesterol didn't go up. Woohoo, right? Well, then you can do another kind of nefarious thing, which is you say, we're going to do a meta-analysis on these studies on eggs and cholesterol. And the time period for the meta-analysis is going to be 1992 forward. Well, now what you do is you lop off all that negative information about eggs and diet and cholesterol that happened before by making your inclusion criteria, the studies that came after the egg board got involved. And that's what they did, and they were able to make a pretty good case based on false premise that it really wasn't harmful to eat eggs.
In Chapter 4 of Food Over Medicine, what did you mean by success stories?
Now, success stories are people who were in terrible shape or sick and not being told the truth about the cause of their conditions or the uselessness of their treatment, and found us somehow and learned how to look at evidence, look at risks and benefits, and make different choices, and actually were able to regain their health that way. And it was them that did it, you know? That's the thing that's so exciting about this, is that the way that medicine is set up right now, it's all about finding a great doctor who has all the answers so I can just do what he says and it's going to end up great. Well, it doesn't end up great. It's about finding out the things that you need to do to improve your health. So that's why we really position ourselves as content creators and an education company, because the people that you have to use this information, go home and fix yourself, right? And that's what these stories are all about. And some of them are just amazing. I mean, some of them I still cry when I think about them. You know, this one woman, amazing story, had leukemia. She wasn't getting better, and she was pretty sure she was going to die. And she just went home and dropped to her knees on the hall floor and said, God, you know, I don't think I want to die. And if there's a way to get through this and save myself, let me know what it is. And she ran into an associate of mine the next day. And you can say whatever, if different people think different things. I kind of think some of this is a God thing. Unfashionable to say these days, but I don't really care about that anymore. So anyway, she found her way to us, and her husband was apoplectic about her not continuing the chemotherapy, but it clearly wasn't working. And she said, I'll tell you what, just give me an opportunity to take care of myself right, the way that these people are showing me. And if it doesn't work, I'll go back to the chemo. Well, it did. And she ended up, and there's the part that always makes me cry, is that the chemotherapy that she had put her in menopause. And after the whole thing was over, she'd always wanted to have a baby, but that wasn't going to happen. And one day she got pregnant. And her menstrual period started again. And she called us, I'm going to tear up, but she ended up having a baby, and he's graduating from high school this year, I think. So, yeah. That's a success story on so many levels, right? And that happens all the time in our office, stuff like that, where little children are sick, parents terrified. You know, one woman found out about us on a park bench. She had a kid with Crohn's disease and not doing well, and she said, I don't even know why I said something. You know, you don't usually talk to strangers about your kid's health condition. And this woman said, you ought to call these people in Columbus. And she said, okay. So she went home and told her husband. They got online and they looked me up. And he goes, yeah, like she's going to talk to you, right? And so anyway, she called, and yeah, we do talk to people. And the little girl's fine. And so you think about this. This is an interesting thing. People in the healthcare field hate it. They're so unhappy. You know, it's unfortunate that most doctors have ended up in a situation where I think they went into medicine for the right reason, but they're certainly not enjoying their careers right now. And I've had colleagues joke to me that, yeah, I wish I'd become an architect, or I think being a plumber would be more fun than this. And so, but the reason is they're missing out on the part of all of this that's so much fun, which is empowering people to take care of themselves, because you get happy endings when people are involved actively in their health status. That's where the happy endings come from. It's not us doing it. It's them doing it. We're just providing, the tools and the information, and that's what's lacking. The information is what's lacking.
Do you have any opinion on sunscreen?
I have an opinion on everything. Yeah, so the problem with sunscreen is severalfold. First of all, it contains chemicals that are only now being tested. Again, our government lets a product be on the market for a long time, and after a few decades, they say, maybe we should see if this is safe, right? It's such a backwards, ridiculous thing. And so some new research has shown that there are disturbing levels of carcinogens that result from using sunscreen. The bigger issue is, if you use sunscreen, you can't produce vitamin D, okay? And vitamin D is needed for function. It's not a vitamin, just so you know. It's a hormone. And so that's why it's not in food. I mean, who goes into the grocery store and says, I'm looking for some foods that contain insulin? Nobody, right? Because it's a hormone that's produced by the body. Same thing with vitamin D. And the natural way to achieve vitamin D is to get out in the sun. So we're teaching people, the sunscreen industry, along with, the sheep of the medical profession who bought into this idea, people should stay out of the sun. It's dangerous. Now, humans have lived in the sun since the beginning of time, so that's kind of ridiculous. And if we were supposed to get vitamin D from pills, there weren't any back in the day, so it kind of makes you wonder sometimes how we survived as a species without all this intervention. All right, so back to the sunscreen. You wear the sunscreen, you don't get any vitamin D production. But another problem is, and we're just starting to find this out, is that when you avoid the sun, first of all, there are 10,000 other photo products that are produced, like nitric oxide that keeps your blood vessels open. So it's the equivalent of smoking in terms of early mortality. And also, you're only blocking out some of the rays, which means that the skin cancer rate is actually going up as a result of people spending too long in the sun. See, I don't ever wear the stuff. So I'm really conscious about how much time I can spend in the sun in April when I start spending time outside, and then throughout the summer. And when I reach my limit, which is obviously more in August than it would be in May, I either sit in the shade, put on something over, wear a hat, something, but I don't let myself have too much sun exposure. But if I'm slathering myself with sunscreen, I walk down to the beach from my summer place and sit out there for 6 hours, my skin doesn't turn color, but 6 hours of sun exposure, even at the end of the summer when I'm already tan, is really deadly, right? So the skin cancer rate is actually going up as a result of the use of sunscreen. Bad idea on numerous fronts.
Should women consider removing a breast as a preventative measure against breast cancer if they're carriers of certain genes that correlate with a higher risk of breast cancer?
No. A short answer, no. And we even have some data. Women who have prophylactic mastectomy, who are like BRCA carriers, the difference in death rate at 10 years is 3%. And I don't think most women would take off their breasts for a 3% advantage. The other problem is that if you're a carrier of these genes, you also have a high risk of pancreatic cancer. I mean, how many body parts can you take out? So the risk of dying of many types of cancer is higher, and the better option would be to focus on reducing your risk of cancer as much as possible, not taking off your breasts and taking out your ovaries and thinking that you're fine.
How do we lower or eliminate the risk of type 2 diabetes?
Type 2 diabetes is almost always unavoidable. It's a disease that is brought about by high-fat diets and being overweight or obese. 88% of diabetics are overweight or obese. And the reason we should pay attention to this is about 80% of the deadliest cancers, like pancreatic cancer, develop in diabetics. So that would be, sometimes diabetics, if they're taking metformin, think, well, I got it all under control. But they don't realize their high risk of cancer. And this just happens real personal to me because a friend of mine in Columbus, who was an obese diabetic all the time that I've known her, developed cancer in September of last year and was dead by mid-December. And that was completely avoidable, completely avoidable. So easy to fix. Start eating a health-promoting diet. And even if you're diabetic, if you've already developed type 2 diabetes, it responds really, really well to diet change. And in fact, many people, that's another one where you have to be medically monitored if you're taking drugs, because you can end up comatose on the bathroom floor from low blood sugar if you're not careful.
Do you recommend people get a yearly flu shot?
The flu shot's the most useless of all of them. They're all of them useless, but completely useless. And the strains never match. It's just the Cochrane collaboration, which up until recently was the most independent research organization on the planet, has done review after review after review and concluded that this shot is useless for everybody, all years, all ages, all side effects, no benefit.
Do you recommend plant-based milks over cow's milk? Do you recommend we drink plant-based milks?
I recommend eliminating cow's milk. But this concept of milk with every meal, that's pretty ridiculous too. Children should be drinking water after weaning. So how you would use plant milks, and I use them myself, is when you're making a smoothie or you're having a big bowl of multigrain cereal that you would normally put cow's milk on and use like a vanilla almond milk instead. But the idea of drinking cow's milk or by drinking plant milk for a beverage, yeah, not so much.
Does higher cholesterol correlate with more health issues such as heart disease, strokes, heart attacks, and death?
High plasma cholesterol levels are directly related to not only an increased risk of heart attack, stroke, cardiovascular disease, but an increased risk of Alzheimer's disease in a dose-dependent manner. The higher your plasma cholesterol, the higher your risk of Alzheimer's disease becomes. But here's something that most people don't know. It also increases your risk of cancer and having aggressive cancers. And the reason is that most people understand that at some point in time, as cells become cancerous, they start to take up glucose at a higher level, 18 times the amount. Well, it takes a long time to build blood vessels and that sort of thing to feed tumors. And so the tumor cells look for alternative fuel, which is cholesterol in the bloodstream. And that's one of the reasons why people who are diagnosed with cancer often have low cholesterol levels at the time of diagnosis, which some people who don't understand the difference between correlation and a cause and effect relationship interpret it to mean that, oh, low cholesterol is bad, increases your risk of cancer. It's actually the other way around. So yeah, good reasons to get your cholesterol down. And by the way, an interesting discovery about that was made when Colin Campbell was doing his research in China, which was observational. But an observation that was made at the time when the study was going on was that people who had higher plasma levels of cholesterol also had a higher risk of several different types of cancer. Now, the purpose of that study was not to look into that particular relationship, but Tom Seyfried has looked into that relationship, and in his book, he was a speaker here last year actually, in his book, Cancer is Metabolic Disease, he discusses that issue at length.
If a health movie appears on Netflix, should we assume it has been vetted for accuracy and has mostly correct information on health and nutrition?
Not necessarily. Forks Over Knives was vetted. I was the person involved in the vetting, and Brian was meticulous about checking things out. One of the things I really respect about him. Other documentaries I've seen, I think the bigger picture is pretty accurate, but I often catch untrue statements being made. Fortunately, the vast majority of the information is true, and the big idea is generally correct. But I wish that everybody had been as rigorous as Brian was in that film.
Can you sum up everything we've talked about in 15 seconds?
Yeah, I think I can actually. The biggest thing that's plaguing healthcare right now that's fixable is lack of informed decision making. If all consumers in the country, if I could flip a switch, and they would all, starting right now, just check everything out in a non-emergency situation before they did it, the healthcare system would be well on its way to being fixed, because 2/3 of what people are currently agreeing to would automatically go away. And over time, a lot of the rest of it would too. That's the bottom line. And it's fixable because consumers can make that decision. We can't fix medical school. We can't fix medical practice. I can't make the FDA stop taking bribes from drug companies, but we can all fix our own decision-making process, and that's really the thing we need to focus on.
What's the one thing I need to do today?
Well, I think the first thing and most important thing is you have to start taking care of yourself and using the same value system that you use for everything else. I mean, nobody lets it rain inside and says, oh, now I should do something with that roof, but you know how many kids I have playing soccer right now? I mean, you don't let that happen. You figure out a way to do it. Nobody drives around on a flat tire and says, I've been working overtime, it's tax season. So we seem to have some understanding of the fact that we have to maintain things in our life. Well, you have to maintain your body, or it's going to end up like the raining inside and the flat tire. And doing it proactively is much easier than trying to fix a situation that has already developed. I was on the phone the other day with a woman who has breast cancer, and she's terrified. And the first thing she said is, I know why this happened. I'm eating a terrible diet. I drank too much. I'm overweight. Okay, I wish that she so much had fixed that before.
What is it about the Real Truth About Health conference that made you want to come speak here?
What I appreciate about this conference is, first of all, the vast reach. How many people see this? Like, not just here, but out there on the stream and later when the videos are posted. And so for somebody like me, who my goal in life is to get the message out, if you want to get the message out, this is the place to be. I think the second thing is that Steve isn't afraid to take a walk on the wild side and invite really outside the box people to share their ideas. And that's important because we talked about censorship earlier. And so the opposite of censorship is allowing people to come and share ideas, some of whom don't agree with each other. You know, I'm sure somebody sitting in the audience says, I listen to this person at 10 o'clock and this person at 2 o'clock, and I don't think they agree on anything. Well, the whole purpose of something like this isn't so everybody agrees. It's to bring a lot of people with a lot of different ideas to share. So that's what brings me here time and time again. And I hope to be able to do this every year.
For people that want to learn more about your work, where should they go?
My website's wellnessforumhealth.com. My personal email address, pampopper@msn.com. I answer all of my emails personally. And I put out a newsletter and video clips every week. Lots of free education that way. So feel free to ask for our free stuff to get to know us better. Thank you.